So first, I'm going to talk to you about the type of therapy that we're going to do. It's called internal family systems, IFS for short. And the main thing to know is that typically in therapy, the therapist talks to the client, the client talks to the therapist, and we talk maybe about different aspects of you, your emotions, your thoughts, your feelings, your behaviors. IFS is different. With IFS, with internal family systems, we are going to be talking to your parts. So I'm going to talk about like what we mean by that. The theory is that we have this authentic self part that is, in a way, perfect. I'm going to find the description here um, to describe it. It's the 8 C's of the self. I'll call it the self for short. Calm, curiosity, compassion, confidence, courage, clarity, creativity, and connectedness. Um, it's basically the best. It's not really a part. It's who you are. It's how you were born. It's what, if you believe in a higher power, it's what your higher power created. Just like this unblemished, kind of perfect, wise part of you, although it's technically not a part. Where the parts come in, what we're going to be working with are your protective parts. So, we're born with this perfect self, this unblemished self, and life starts happening. So we start to get these little injuries and we start to figure out life isn't fair and okay, we're not good at basketball and things start to hurt our feelings. And to sort of learn to cope with these difficult emotions that as a child we don't even have the vocabulary for, we develop defenses, protectors. So that might look like self-criticism, that might look like sarcasm. Eventually later in life, it might look like alcohol or avoiding or hiding or running or fighting. We develop these protectors,
Hmm.
and those are the parts we're going to be working with. So as your therapist, what we're trying to do is unburden these protectors. They work very hard. They have good intentions. They're trying to protect our injuries. These injuries
Hmm.
are called exiles. These are parts that are hidden that we don't want exposed and vulnerable. But first we'll talk with the protectors. So,
Okay.
and real quick, there's two types of protectors. There's the managers that deal with like the day-to-day stressors. It's sort of like the operating system that we go on as we go through our day. But then there's also the firefighters, and those are the protectors that show up when we're really triggered. When something bad happens, it's not sometimes it's not the pretty part of ourselves. Um,
Oh.
so that's an overview. It was pretty concise. I try to keep it short, but just to give you a sense of you've got this perfect self. Today we're going to
Mhm.
be talking to your parts. Again, it's going to be not so much me talking to you. It's going to be me asking you and you asking your parts questions, and that'll be how the dialogue is set up. Does that make sense?
It does a little bit, yes.
Okay, well, we'll figure it out. We'll figure it out. Do you think you want to do this kind of work? Does this sound interesting? It's a little different.
Yeah, so I want to try it.
Okay, and this is backed by research. It's been shown to be very effective for trauma, anxiety, depression, the whole gamut. It's a newer therapy. Again, it's called internal family systems. So to start, this is all about looking inward because like I said, you're going to have a dialogue between yourself and your parts. So it helps people typically to close their eyes if you want to do that and take a couple of deep breaths. If you want to do that right now, feel free to start
Okay.
and just get comfortable.
Hmm.
Slow down. Feel your feet on the floor. Feel,
Do I need to keep my eyes closed?
you can if you want. I mean, if it helps you look inward, that's the thing, because you're listening for an inner voice. Okay. You have all these
Okay.
parts, all these protectors, and just kind of let go of any tension in your body. You might notice your shoulders are tight, maybe your jaw is clenched. Just take a moment.
Hmm.
Okay. So, what part needs attention right now?
I guess criticizing myself.
Your self critic?
Correct. Yes.
Okay. Yeah, we all have that. Okay. So your self-critic is showing up right now. We've got this committee of parts, and this one wants the attention. Um, where do you find your self-critic in your body or maybe even around your body? Does it show up in a specific spot?
Well, I guess just when I'm thinking of, like, I was cleaning my closet, right? I was cleaning my dresser, and I was
Yeah.
taking out all the clothes that I feel like, oh, I can wear, I cannot wear. I have to lose weight. I'm gonna save these for later. So I started thinking, oh my God, I gotta lose weight.
Okay, so that's kind of what maybe triggered this part, right?
Mm-hmm.
Where is it in your body? Does it live in your gut, in your chest, in your mind?
Mm, in my mind.
And when it's activated, when it's kind of running the show, and you've probably seen the movie Inside Out,
Mm-hmm.
and it's driving the bus, what does it feel like? What do you notice in your body?
I guess my heart is racing.
Oh,
No, my heart is racing. My mind is thinking of all the things I have to do, like what I have to eat, how I have to eat. Oh my goodness, I have to start my shakes again,
all
or else I'll
right.
be eating eggs every day. So yeah, that's a
Sounds like an overwhelming kind of feeling.
yes.
Flooding. Yeah, okay. So take a moment, relax your shoulders. Can you focus your attention on this part and internally ask your other parts just to soften back, just to step back for a second so that this part can get your full attention?
Mm-hmm.
Okay. Do you notice anything about this part? Does it have a shape or a color? Does it have a particular voice or anything noteworthy about it?
Not really.
Okay.
Am I supposed to see a color or feel?
You might, some people like, if they're dealing with their angry part, they might see red. You know, you're dealing with your inner critic.
Oh, I
Um,
see black. I just see black because I'm so angry.
okay, that helps. That helps because that'll help you visualize this. So go with that. You see this black part that
Mm-hmm.
can run the show sometimes.
Mm-hmm.
Just pay attention to it. We're just going to sit with it for a second, see if it does anything. It may not. Is it saying anything to you?
No, but I feel like it's getting lighter.
Oh, interesting. Okay.
Like it's not as heavy.
Wow. All right. So
And
in your
um,
mind, you're doing fine. This is great. This actually already feels like progress just by identifying the part and giving it some attention. And we're changing your relationship with this part. It's not going to be as combative. Um, ask the part if it's okay to ask it a question.
oh, okay. Mm-hmm.
The question is, what is this part, your inner critic, what is it afraid would happen if it didn't do its job?
What would happen if it didn't do its job?
Yeah, it does some self-criticism and it's
So if
doing
it
it.
didn't do the criticizing,
Yeah, it has a role.
if it didn't do the criticizing, then what would it be doing? Is your question?
What what would the consequence be?
Well, the
What's it
consequence.
afraid would happen to you?
Gotcha. I guess I would not listen to that voice and I will eat everything in sight. So I have to listen to that voice. I
If
know it
the
hurts and it's frustrating,
Okay.
but if I don't listen to that voice, I will eat.
So this part's job is to help manage your eating. That's why it speaks up.
Mm-hmm.
So it's afraid that if it doesn't do its job, that your eating might get out of control. So we want to change our relationship with this part. It's got a good intention. It's trying to help you, right?
Yes.
Maybe its methods aren't great, maybe, but we see the good intention. No bad parts. Can you have a conversation with this part a little more in your head? You want to ask it if there's anything that it wants you to know?
Mm, can't think of anything other than I have to listen to it. I better listen to it or else it's gonna get bad. I have to. It tells me that I have to lose the weight. That I will do it because I've done it before.
Hmm.
So
How
it does
long
encourage me.
how long has this part been doing this job?
Oh, for years. For years. Since COVID.
All right, look inward and ask this part if it's tired.
No.
It's not tired. It's
It's
been doing
not
this job for years, but it's not tired.
no. Because it's what keeps me regulated.
I
It's like
see.
I have to listen to it because it has told me before and I have to hear it. So it just comes and goes then, I guess. If I was to explain it that way.
Got it. I'm going to ask another important question. You're going to have to turn inward. You're going to ask the question and just be quiet and really listen for a response. How old does this part think that you are?
Hmm. It's a good question. Um, 14.
Wow.